Let's compare type 1 and type 2 diabetes step by step. First, the age of onset. Type 1 diabetes usually start during childhood or adolescence, whereas type 2 diabetes is more commonly seen in adults. Although nowadays it is also increasing in younger people because of obesity and sedentary lifestyle. Type 1 diabetes has a sudden onset, whereas a child may become sick within a few days or weeks. On the other hand, type 2 diabetes develops slowly. Many people don't even know they have diabetes until it is detected during a routine blood test. Type 1 diabetes, the body immune system mistakenly destroy the insulin producing beta cells of pancreas. As a result, the pancreas produce little or no insulin. The insulin factory is destroyed. Now in type 2 diabetes, the pancreas is still producing insulin, but the body cells don't respond to it properly. This is called insulin resistance. The factory is working, but the workers are not accepting the product. Family history is less common in type 1 diabetes, but it's quite common in type 2 diabetes. Body weight, type 1 diabetes are usually lean and underweight because they cannot use glucose properly. Patients with type 2 diabetes are often overweight or obese, although not everyone with type 2 diabetes is obese. Type 1 diabetes symptoms are usually very obvious, like frequent urination, excessive thirst, increased hunger, weight loss. In type 2 diabetes, there may be no symptoms at all, especially in the early stages. That's why it is often called a silent disease. Ketosis. Type 1 diabetes has a higher risk of ketosis or diabetic ketoacidosis because there is almost no insulin. In type 2 diabetes, ketosis is much less common because some insulin is still being produced. Treatment. People with type 1 diabetes must take insulin throughout life because their body cannot make enough insulin. In type 2 diabetes, many patients can initially control their blood sugar with diet, exercise, and oral medicine. Some may eventually need insulin if the pancreas become exhausted over time. So type 1 is no insulin production, type 2 is insulin is present, but the body does not use it properly. This is the biggest difference. So type 1 is insulin deficiency while type 2 is insulin resistance.